Welcome to Raw Female,
a podcast that offers an unfiltered look at women in midlife.
We're your hosts, Kris
and Allie.
Hey, we're back with the second half of our interview with skin guru Stephanie Cullinane.
We love her.
We learned a lot last week.
We learned a lot. Last week was awesome.
She gets in the cracks and crevices.
She does.
Let's just cut to the chase on that.
Yeah, there was some vagina talk. Yeah. I'm not going to lie. I mean,
always.
If you haven't listened to it, listen to it. She's great. It talked a little bit more about the medical side. Yeah. The first interview. This one now will be a little bit more cosmetic, which I love all those lotions and potions.
We do. And stay tuned at the end for the dermatology rapid fire.
That was
by the way,
fun,
she
actually.
slowed that way down.
I know. I thought it was going to pop a little bit more. We're going to get on our game on that rapid fire.
She's a thinking person.
Yeah, I know, not like us who are just like going after it. Anyway, everybody enjoy.
Turning to the cosmetic branch of your work, let's just start with a basic, which is, depending on the woman, what would you suggest a healthy daily, monthly, yearly skincare routine to look like?
Well, I think having a good pH balance cleanser is good. I think a lot of people pick the wrong cleanser. So our skin runs a little more on the acidic side. Our pH is about 5.5. So you want to make sure the cleanser kind of matches that pH.
Okay, so, I never thought of that.
The pH?
I just pick which foams nicely and blah, blah.
Foaming cleansers tend to be more in the right pH.
Oh, they are?
Going to alkaline can actually be a little more drying.
Oh, how do you know the pH of your cleanser?
A lot of times they'll say it's pH balanced if it is to match the skin. But I think you could probably, on some of the products, they advertise it on what the pH is.
Oh, so what should the pH be between? Do we know?
Between 4.5 and 5.5 is probably a good number.
Okay.
Is there also an ingredient or ingredients in that cleanser that we should either avoid or not? Or is it just the pH we should look at?
I tend to pick things that don't have fragrance, dyes,
right?
Parabens.
So the natural.
Too many preservatives. Well, just too many unnecessary stuff that can irritate the skin. I mean, I see a lot of patients for rashes, skin irritation. So, that's one of the things we talk about is just kind of avoiding unnecessary stuff so it's not irritating your skin.
Do we over cleanse? Do you think as a society?
Oh, probably.
Probably.
Wait, do we need to cleanse in the morning and at night?
I think it's a good idea. We get involved with a lot of junk during the day. There's a lot of pollution out there. So I think doing a gentle cleanser twice a day is a good idea.
So my thing is I like to cleanse in the morning because I'm in the shower, so it's easy. But at night, sometimes I just take off the eye makeup and call it a day, which is terrible. Right? No moisture.
Yeah, you're
this
like,
is all
this is a 911 now for you.
I got to cleanse earlier.
I'm
in the
the
evening.
total opposite because I have dry skin, so I feel like if I
well, are you moisturizing?
You wouldn't even believe how much I moisturize.
So maybe we should look at the pH of your cleanser.
I just went through all of that.
Yeah,
I feel like as I'm aging, I mean,
our skin can get more dry.
I'm just drying out. I'm just getting more and more dry.
And some people just inherently are more dry.
Well, see,
there we go. We just had this
discussion where I went into, and I love this store, Credo Beauty, because they vet all their products. So they have lots of product that doesn't have a lot of crap in it, basically. Right. So I know I'm at least starting there. And I walked in and I said, so I just feel dry and underneath my eyes, I'm dry. And she took one look at me and she goes, well, first off, you are dehydrated right now. I can just tell by your skin. Who knows if she can actually tell, but she's like, you're dehydrated. And she said, there's probably a genetic you probably just run dry.
Yeah.
And so what would you suggest since we're talking about healthy daily, monthly, quarterly, yearly skincare for somebody that has regular, like Kris, I don't think you're as dry.
Nope.
Well, they do make cleansers that are more hydrating. So I would.
That's what I'm using. I'm using a hydrating cleanser, and I'm only doing it once a day at night. I'm doing the opposite of what you
should
do.
be cleaning at night.
I think you can do the hydrating cleanser twice a day.
Okay.
And then put on a moisturizer right after.
Okay.
Yeah.
Okay.
Okay, so we got the cleanser situation. We're going through our things. Okay. So we got the cleanser, and we're thinking we need a pH balanced. You can do it once or twice a day.
I had no idea that pH was what I was supposed to be looking for. I thought I was supposed to be looking at, here are the ingredients to like keep away from.
I don't know. I'm very happy about this.
Yeah,
anything else with the cleansers? Does price usually, is there a correlation between price and effectiveness?
I don't spend a huge amount of money on my cleansers.
Yeah.
I just think,
right.
There's other products that are a little bit more expensive to create and produce that I put my money more.
We're going to hear about those. Okay, what comes after the cleanser? Then what do we do?
Then you moisturize. Well, some of it depends on what you're using in your skincare regimen. So a lot of it has to do with molecule size. So if you're doing a few steps of, let's say you're doing an antioxidant like a vitamin C serum, that molecule size is pretty small. So if you put a moisturizer on, then you try to put something that has a smaller molecule over it, it's not going to absorb in.
Wow. Yeah. That was a great takeaway and easy to understand.
Yeah.
Okay.
Interesting.
Molecule size.
So antioxidants, I think, are pretty important. There have been a lot of studies. You had asked me about melasma, that helps decrease melasma because melasma as a memory, so it's our pigment cells getting active. And if we can kind of calm down that activity, then the pigment cells aren't as active.
So when I was in your office, we talked about, and I use the TNS product, which is a antioxidant.
So it has an antioxidant, also has growth factors in it and
growth
peptides.
Factors. And everything I've read about that product, everything I've seen about that product is like great. It sounds great. It's expensive, but that's an example of an antioxidant product,
SkinCeuticals,
correct?
They make vitamin C serums that have a lot of data behind them, and they have some patents. Then they're the ones that a lot of articles always seem to kind of mention,
right?
Just because they have good science behind them. But there are other good antioxidants. Vitamin C serums. Some people can't tolerate it; it's a little more acidic, so some people get irritated skin. There's coffee berry extracts. There's green tea. There's resveratrol, which is just your background. You'd appreciate, deals with wine.
Oh, is that right? Is it like a grape-based product?
It is.
Oh, interesting.
Yeah. Well, I think there's different places you can get resveratrol. It's produced by plants in response to UV stress, things like that. So,
but your takeaway really is you got an antioxidant and a vitamin C is really like next step after.
Think of it as like a pyramid, and the base of your pyramid would be like sunscreen, antioxidants, and then you start building from there. DNA repair, so things that help repair the damaged DNA.
Is that a real thing? I have to ask it because it sounds so hokey to me. DNA repair. I mean, I've seen the ads for DNA repair for years. So what is that?
So those are different substances that help repair some of the damaged DNA. And there's so many different ingredients that have, some science behind it. And there's even sunscreens that put in DNA repair, and antioxidants. The niacinamide with the vitamin B3 is in a lot of sunscreens and skincare products to help as an antioxidant.
Do you have a suggestion of where is this like a natural store, like homeopathic store?
I think you can
find get these over the counter at like Walgreens
For sure. I mean, some ingredients, they're fillers and sort of the vehicles they put them in may be a little more elegant and a little higher end. So that's what you're paying for as well as how they stabilize the ingredients. So you can take a vitamin C serum, and as soon as you open it, it's starting to oxidize. And, in a week or two, it's not doing its job. And there are other ones that they produce to be more stable, the packaging they put it into, the chemistry that goes into creating the product. So, there are certain things that you can spend more money on and get a good investment back. People put peptides in. They help kind of make our skin look a little more plumper, a little smoother. People use retinols or retin-A's to help exfoliate and turn over the cells and stimulate collagen. alpha hydroxy acids, same idea, you're turning over the skin, stimulate collagen.
We need to talk about sloughing agents.
We do need to talk.
And we also need to talk about, we were getting into the creams and the molecule size. So we need to do the protocol.
So smallest to largest.
Smallest to largest. So how do you know if it's a small molecule?
I think you need to have somebody who knows about the products.
Okay.
Yeah. I mean, obviously serums are going to be smaller molecule size than like a creamy moisturizer.
Okay.
I usually do my serums first, then my moisturizer, then my sunscreen.
Okay. So sunscreen should always be at the end after the moisturizer.
I think so.
Okay.
That's how I usually recommend it.
Okay. And eye creams, give us
people always ask me about eye creams.
Yeah.
You just want something gentle to moisturize. It's pretty delicate skin.
Right.
So I have a lot of people come in with eyelid rashes from trying a new eye cream. So
that doesn't make me feel good about an eye cream, that you have a rash from it, really.
Well, you just want to be careful of what's in it. There can be retinols in it, and if you have sensitive skin, but that also can help just with the fine lines. So I always say do a test area first, just to see how your skin does with it.
Why does retinol help with the fine lines, but it's also a exfoliant, right?
Well, because it turns over the skin.
So how does that help? Because
it helps stimulate collagen. It helps thicken the layers of the skin underneath.
Oh,
so
is what's helping with the fine lines the collagen?
So it's actually Retin-A or tretinoin. Mm-hmm. It's probably got the most science behind it as far as an anti-wrinkle cream. We've had it since, I think, the 70s. So we have a lot of years in science to kind of show us that it does help thicken up the deeper layers of the skin and turn over collagen and help with fine lines and wrinkles. But there's a tolerance issue for some people. And I always, it's the whole thing of like, well, if this strength will do well, then I want the one that's 5 times stronger. And, you have to sort of tell people just because it's stronger doesn't mean it's going to work better. It just can be more irritating. So a lot of the ones that are marketed for anti-aging are in a lower percentage.
Okay. So then we should transition to the sloughing agents because that's considered would be considered a sloughing agent,
I can't
right?
tolerate any retinols. My skin's too sensitive, but I have a lot of patients who can.
Okay.
Even just using it 2 to 3 times a week.
Okay.
Or retinol, which is the over-the-counter version, is more mild, and some people tolerate it better. But there are some anti-aging sort of versions of retinols or Retin-A that they put in like a hyaluronic acid formula, so it's supposed to be more moisturizing. So some of it's the vehicle that it's in.
Okay.
Also, people tend to use too much, so it's a very small pea size amount to the whole face, and not to apply it right after you've washed your face. Wait about 10-15 minutes till your skin is dry and moisturize it before you put it on. So you wash, moisturize
before you put it on.
So you'd wash, moisturize, wait about 10-15 minutes, and then it's a pea size amount. But again, your skin needs to build up a tolerance. So starting out 2 to 3 times a week, even diluting that little pea with a little bit of moisturizer can help build up your tolerance.
Is there a concern of the skin thinning too much, or is that just people that are just using that product too much?
Well, it's more the top layer of kind of the dead skin.
Yeah.
So you're not really thinning out.
You're not thinning anything.
No,
you're just because I've just heard people say that.
Right.
Like, it thins my skin, or I think that's probably a misnomer.
I think they're thinking about the St. Ives scrub, that you're scrubbing so much that your skin.
Yeah, it actually thickens the deeper layers of the skin.
The retinol.
Mm-hmm.
Yeah.
And Retin-A.
And I'm sorry. So the retinol you said was
it's a weaker
over the counter.
Yeah, that's
the
the
retinol,
over the counter.
The Retin-A. So
they're vitamin A derivatives.
Okay. So do you suggest that someone start with a prescription from their dermatologist to start Retin-A, or?
Well, it certainly can be a good part of an anti-aging regimen. Mm-hmm. And then you can, kind of have your skin assessed, see what the right strength is, and also have some education about the correct way to use it. And then if you're having a side effect with it, sometimes it's just how you're using it.
Mm-hmm. Okay.
Or what vehicle it's in. Sometimes people get it in a gel and that's too drying and they should get a cream instead
So
or a
then
lotion.
you need to try out probably different versions on your skin to see which one fits for you, correct?
Yeah, I mean, I usually start people out on a low strength in a cream based. I'm not going to put most patients on a gel.
Okay.
So what's the difference between using something like that and going to an esthetician to do like a microdermabrasion?
Well, there's just
like
different ways you're kind of getting off the dead layers of the skin.
Is one better than the other?
No,
or
just
they're
different.
just all different?
And they can all kind of complement each other.
Okay.
So whether, however you're turning over the skin helps. So whether you're doing it with like a microdermabrasion or you're doing it with a chemical peel or you're doing it with a retin-A, it's all turning over the skin.
Okay.
So you said 2 times a week.
I would start 2 to 3 times a week and increase the frequency as you tolerate it. So if you're not having any redness, irritation, go up an extra day that week. And then if you're doing okay, the next week you can go up an extra day. But I have a lot of patients who use it every single day.
Interesting. Okay.
What other sloughing agents are there? Aren't there acids like lactic and salicylic?
There are lactic acids. There's
glycolic
acids. So all the different kind of alpha hydroxy acids.
What's your thought?
It just depends on your skin type. And, it's also how strong they are. So you can do a very light peel and that you may have, some skin sloughing for 3 to 4 days, or you could do a pretty aggressive peel, which you're going down deeper into the skin and you're going to have much longer of
really more than 3 or 4 days.
Well, you could have don't you remember the Sex in the City where she came out and did a peel?
No.
Oh my gosh. Yeah, you could have, even up to a week, depending on how, but you're going to have much more of a substantial result from a peel like that.
Oh, wow. Okay.
Yeah. I mean, I think with lasers, peels have fallen a little bit out of favor. And people have been doing more like fractionated lasers like Fraxel to get, similar results.
Oh, but the lasers. Yeah. Okay. Let's talk about those at some point.
Area, the brown spots.
Okay.
Well, that's different.
Yeah, that's different than...
We have lots of different lasers.
Yeah,
and they all
that's
do
different than
things.
what you're talking about.
Yeah. So the fractionated lasers actually create a little bit of damage in the skin. So let's say an average with something like Fraxel, you may create about 30% of damage in the skin. So the skin around it needs to heal it. So it stimulates collagen and all these wound healing mechanisms. And that's how it helps repair the skin. And that's what reduces the fine lines, the wrinkles.
That's the fractionated laser I've heard about.
Yeah. So Fraxel was kind of the first one that came out. It's kind of like Kleenex.
Okay.
But there's lots of other fractionated lasers on the market. And it depends on how deep into the skin you go. So you could go much more aggressive and go deeper into the skin. You can go a little more superficial. So if you go, if you're trying to get lines, you might go deeper. If you're trying to get more brown spots, you're going to go lighter.
So if you've got, let's say like we've got, which is probably partially sun damage and partially hormonal melasma leftovers.
Yeah, you have to be careful with the lasers because if you go kind of too deep or too much of it, you can start stimulating the melasma.
Got it. Interesting.
Yeah, so, going a little bit lighter. Also pre-treating with something like hydroquinone for about 4 days before you do the laser just to kind of put to sleep those pigment cells can help.
But there's not it doesn't seem like there's a perfect solution for those because even if you do the lasers, you got to come back every year.
Well,
probably,
like I said,
right?
those pigment cells have a memory.
Yeah.
So unless you maintain it with something, it comes back. So, I always have people come in and they're like, oh, I'm out playing tennis all the time and I'm not really good with sunscreen and I don't wear antioxidants, but I want to do a laser to treat all my brown spots. It's like, well, okay, but you'll have them all come back pretty quickly if you're not going to maintain it.
Got it. So is your protocol when somebody comes into the office for something that's like a brown spot or something, you look at their skin, you evaluate their skin, and then you put a protocol together for them based on what their skin kind of sensitivities are, their skin tones, their history?
I think it's also kind of assessing what bothers somebody.
Right.
Yeah. I mean, if somebody says brown spots don't bother me, as long as they're not atypical and they come in for their regular skin cancer screenings, I'm not going to recommend that they treat them. Same with wrinkles.
So are you seeing anything trending? Right? Do things trend? So like you come in, you see a lot of women coming in for, or men coming in for very certain specific things like, oh, I want the, the hydroquinone, whatever it could be, or the specific lasers. Does it come in waves a little bit? It comes
in waves. It probably depends on the demographic. I think women in like their 40s, 50s, 60s don't seem to kind of look to as many, quote, trends. That tends to be more of the younger people. Like, what's Kylie Jenner putting on her face?
Oh, right.
Oh, you get that. Oh, yeah. What's our demographic doing?
I think they're making more sensible choices. They're asking their friends. They're asking their dermatologists. They're asking, they're doing a little bit more legitimate research rather than who's on Instagram putting on what.
Exactly.
But are you seeing women our age having similar issues, probably with the discoloration of their skin and the sloughing, right?
Yeah.
That seems to be something that we talk a lot about, and maybe some of the laser stuff.
Yeah, I mean, there's intense pulse lights. They also are called photofacials. There's clear and brilliant, which is a type of laser that's superficial. It's just because not only, so all part of the sun damage, you don't just get the brown spots, you get the dilated blood vessels, you get some background redness. So a lot of times the machines will try to address both things to reduce down the evidence of the sun damage. And I think with most treatments, if you can get about a 50% reduction, it's done a good job.
So we probably should have asked this at the very beginning, but I'll ask it now because we talked about dehydration earlier, and that gets more towards the diet and like drinking water and what you eat. Is there a correlation between me drinking like a ton of water every single day?
Probably not.
And right.
Dry skin?
And dry skin, or
we get a lot of water in our food. I mean, certainly a healthy diet is important. A diet rich in antioxidants and green leafy vegetables and not having sugar. But you got to also live and enjoy your life.
Right.
So certainly, if our diet is mostly plant-based and we stay away from sugars and too much alcohol, we get lots of sleep and we don't have stress. How fabulous.
Yeah, how fabulous we would all look. I want to live in that utopia.
But I also try to be realistic and practical.
Right. Exactly.
You got to treat yourself too.
Right. But can you, do you ever get a client who comes in and you do start doing a deep dive on the diet, or is that something that you tend to leave to their nutritionists?
Well, certainly with some of my acne patients, who want to kind of address that, there's certain things that can work for some people that don't sort of influence or throw up all our glycemic index. So having, more complex carbohydrates, not carb loading. So, you have more of a healthy balance of healthy lean protein to green leafy vegetables, not starchy vegetables, low sugar, good fats, olive oil, avocado. Our carbohydrates and our grains being more from its kind of pure natural source rather than too processed, our skin will probably look a lot better.
Right.
I mean, you look at certain cultures that have completely different diets than we do, and they have much better skin as far as acne and things like that goes.
Exactly. Okay. Are there any trends right now that you see are becoming that you're getting a lot of questions on?
Certainly there are things that I think should be more trending.
Oh, such as
that people aren't.
Aren't jumping on.
It's funny. Like we've had, there's been a procedure out for a few years that I'm just surprised hasn't caught on as much as I thought it would, which is Kybella.
Oh, which is, my gosh.
Which is for the fat under the chin.
This is you. This is here.
Okay,
let's
so Allie,
it works really well. I mean, it was out for a while and then it went away, and then Allergan, who is a big cosmetic company, bought it and did a lot of the new studies on it and brought Kybella to the market. But it's a permanent reduction of the fat under the submental fat under the chin.
Oh, yeah. That's what I'm talking about.
Jowl.
Yeah. Well, I think at some point it's going to have the indication for jowls. Right now, it's got the FDA approval for the submental fat.
Okay.
But it's permanent. So, I mean, when you look at people's faces, that can really kind of sharpen up the jawline and make it look younger. So that was kind of a trend that, I mean, certainly we have people come in, we offer it, we do it a decent amount, but it was one of those things that I thought people
would jump on.
Line up for.
Right.
Like we would be doing 12 a day.
Yeah. How effective is it? Because
it's very effective.
Really?
I mean, you need a series of treatments. So, it's usually the treatments are done about every 6 to 8 weeks. It takes about 3 to 4 months to see the full results. So it depends on what you start with, but I'd say the average person may need anywhere from 2 to 4 treatments.
And what's happening with
So basically, it's deoxycholic acid, so it's bile salt. So it basically just breaks down the fat cells.
And that's just for the chin line.
Well,
correct?
that's what it's FDA approved for.
Got it.
So there are probably people experimenting with it in other areas.
I'm sure.
So over the years, we find other ways to use things. But the bottles are pretty small and you have to do injections and it can swell up a lot afterwards for a few days. Kind of look like a little bit of a hamster.
Froggy situation.
Froggy.
Yeah.
So
is it pricey? What's the price point look like on that?
It varies. It probably depends who you go to, but I'd say, I don't know, probably anywhere from $600 to $900 a bottle. And, and people give discounts based on how many bottles you're buying. If you buy it in advance, certainly who the injector is. But I think for something that's permanent, it's not surgical. I'm just, there may be a practice out there is like, we're doing 20 of them a day.
Right.
But it's just one of those things like, I thought it would be probably as popular as something like Botox.
Right. Botox seemed to take
took off and has maintained for years.
Yeah.
And this sounds like is it more of a natural product or what you're injecting in there? What are you?
Botox is a purified protein, so it's kind of natural.
Okay, kind of natural. Okay.
And we use it for a lot of medical reasons too. So migraines.
Yep. Excessive sweating.
Yeah.
Right. Don't people get?
Yeah.
What else do you think you were surprised that didn't take off? Was there anything else?
That's just the one thing that I think about it. Like, especially like when I look at people, I'm like,
yes.
I never want to say anything because, if it doesn't bother somebody, and I'm not one to sort of sell stuff to my patients like, hey, have you ever considered doing this? It could really help your double chin.
Right.
But if somebody asks me about it, I'm happy to talk about it. Or if somebody says like, well, what would if you look at me, like, what do you think would help? This, like what would improve this, then, I'll talk about it. But I'm not just going to, somebody comes in for a skin cancer screening, be like, hey, while you're here.
My guess is they don't know that it's around there because you and I talked about because Kris has the same complaint.
Got that thing. And that was the first thing.
And I didn't know anything really about that, that procedure and product. So I'm guessing Botox has been out there really, it started like multiplying itself and started marketing itself.
Well, I think it was I think people also can get a little cosmetic overload. When Botox came out, there wasn't a lot going on. You know what I mean?
Yep.
So it sort of came at a good time. I mean, people were doing some collagen, people were doing some peels, but now we have so many of these kind of like minimal downtime procedures that I think people are just sort of, it can't get the spotlight in the same way anymore.
Right. I can see that.
Yeah.
Okay, Kris.
I know.
I don't know. That seems
that's going to be an offline discussion we're going to drill down on. But it's come up in my life because I inherited that genetic component of
Yeah, I mean, I did it. I mean, even people who are on the thinner side, seem to have
gives you a definite, more defined
I definitely feel like I got more of a defined.
Yes, I know. It looks good. Well, the question for me was like the nerves down there.
Yeah, are there any side effects or downsides to the procedure?
There's a small risk of hitting the nerve, the submandibular nerve, which in the studies took anywhere from days to weeks to months to resolve. I think in the study, all of them resolved. So you can get an asymmetrical smile if you hit the nerve. Knock on wood, I've never hit the nerve. But some of it is, people can have a little bit of a placement different than the typical person. But as long as you stay away from a few danger areas, you tend to be safer.
To be continued.
I think that's to be continued.
Yeah, because, Allie's worried about her brown spots, and I'm thinking, oh, pity poor Allie with the brown spot. I got the whole, wishing, longing for a jawline.
And some people don't do Kybella. There's also Cool Sculpt, which can be done on the chin. We don't do that area. But and some people combine both, where they'll do Cool Sculpt in the middle and Kybella at the sides just to kind of sculpt it.
Is Cool Sculpt a permanent thing? Oh, it is.
Yeah. We are born with our set number of fat cells.
Right.
And they can shrink or expand depending on, our diet and exercise level and age and things like that. But once you destroy the fat cells, they're gone. So like liposuction is permanent. And Cool Sculpt is permanent. There's lasers that try to destroy the fat cells. So once you effectively destroy them, they're gone. You can swell the existing fat cells. You're never going to remove 100% of the fat cells.
Okay.
That's why, people say, oh, I had liposuction and, the weight went elsewhere. It's like, well, it's probably that you gained weight elsewhere and you saw it disproportionate.
Yeah.
Right.
Because in the area that it was taken out, you didn't see it as much.
You didn't see it. Yeah. Okay. Well,
so I do, cool, because as we age too, we get a little bit more of that abdominal belly fat.
Your body kind of changes a little bit anyway.
Right. So Cool Sculpt, people ask for that to do the love handles, the flanks, the bra fat, the abdominal fat, upper arms.
I feel like you're just honing in on that jawline right now, Kris. You can't think about anything else.
Yeah, because it's funny, the jawline, but like bra fat, I kind of I have no issue with that.
You
like I didn't even know that was a thing.
Because you can't
even
see
though
back
I
there.
own it.
You can't see back there.
But it's never bothered me. And
I can't see it.
Yeah, I
so
can't
don't
see
really
it.
care.
It's not there. But that, yeah.
But I think also, a new trend now is also taking some of these products like fillers and Botox and putting into the skin a different way. There's a procedure called Aqua Gold where you take this little ampule that you can put in PRP, which is from our blood. It's plasma-rich protein. You can mix in a little Botox, little fillers, and you basically take these little needles just to put it into the epidermis to kind of shrink the pores and smooth out the skin. So it's working differently. So we're kind of taking some old products and making them new again.
Well, when we talked about that, and I said the analogy was like aerating your lawn.
Oh,
remember?
Well, that was another thing. I wanted to
different-
ask you about that.
So
let me see if I
and
got that.
We've got about another 10 minutes. So let's,
and we need to do our rapid fire.
And we need to do a rapid fire.
Yes.
So we should probably move it along.
Yes. But a friend of mine this could be offline or whatever, but not really because we could use it. There was some kind of aeration thing where they go in and they
needle
scratch
you.
it. They scratch you.
Oh, microneedling.
Microneedling.
Yeah. I like microneedling.
You what? You love it?
Yeah.
And what does that do? Is that a
tell
similar
me what's going on there?
stimulating the collagen?
I always think of it as like the poor girl's Fraxel. So it's basically you're creating a little bit of damage in the skin, like a Fraxel, but you don't have the heat. So you don't get as much benefit per se as with Fraxel. I like it for myself personally because you don't swell. I swell with everything. So after I've done a Fraxel, I really swell up. Most of my patients don't, but you will look it depends how aggressive you are, but you can certainly look like you have little tiny bruises under the skin for up to a week. So it just depends on how deep you set your needles. You can go pretty superficial, go over the whole face, or you can go deeper. But basically you take, different machines have anywhere for probably 12 to 36 needles. And it creates this little teeny damage in the skin that then heals and stimulates collagen. And you can infuse things like PRP, which is plasma-rich protein, which, we draw your blood, you spin it out in a centrifuge. PRP is also used in orthopedics. My daughter had her wisdom teeth out. They put PRP in the cavity where her wisdom teeth were.
Wow.
So yeah, PRP is pretty interesting.
That is.
So you
I like
can infuse
that. That's
different
interesting.
things into it. But they call it, which I think it's a it's a trademark, the vampire facial. So people think they leave with like blood on their skin.
Yeah, this is what I read. Right.
PRP is like clear yellow.
Right.
So certainly you can get pinpoint bleeding from microneedling, but you're not like smeared in blood when you shave. It's not
good
what
to
happens.
know.
Right.
Good to know.
Okay.
Should we do the dermatology rapid fire?
I think it's time for dermatology rapid fire. Are
go.
you up for it?
Sure.
Okay. So the way it works out is that we're going to alternate and tell you what the problem is. And then you're going to just rapid fire the solution.
So I have to think really fast.
Yes, you do. Yes, you do.
Okay, ready?
Okay. We're going to have you start because it's your little
the first
pet
one's
peeve.
my thing. Brown spots.
Laser, bleaching agents, chemical peels, sunscreen.
Crow's feet.
Oh, you know, I have an affinity for crow's feet. Those are happy lines. They're from smiling. But if you don't love them, a little bit of Botox works very well to soften the lines. I'm not a big proponent of knocking them out completely because I think it can look a little flat when you smile. But a little light Botox can certainly soften those lines. And you can even do things like microneedling and lasers to soften them if you see them at rest. But those are active lines. So when you smile, if you don't want to see them as much, Botox works well.
Forehead lines.
Botox. Yeah, but as we age and our eyelids feel a little heavier, we tend to compensate and are kind of using those forehead muscles to lift up and kind of open our eyes up more. So if you use too much Botox, it can feel a little heavy and you can't lift up your eyelids as much. So you just have to be careful to not go too strong. Starting Botox earlier does help with that before the lines get set.
Ooh.
Because once those lines are there, they're a little harder to get out without getting a little stronger.
Droopy eyelids. That's the transition to droopy eyelids.
There are some lasers and like a fractionated like radio frequency or ultrasound techniques. So there's thermage, there's therapy that they can do to kind of try to shrink up the tissue. But probably the thing that works best is blepharoplasty, which is a surgical eyelid lift where they take a little of the excess skin out.
The chin waddle.
Again, radio frequency ultrasound can tighten it a little bit, but surgery probably does the best.
Smoker's lip.
So people have used Botox, and you can do Botox to kind of soften that pursing line lips. You can't always drink as well through a straw or form your vowels as well if it goes a little strong. So it certainly can be combined, and some people really like it. So that's one thing you can do. It's a little Botox in the area. I like fillers. You can do a very thin filler, just fill in the line. Microneedling, lasers can have really good results. A lot of things can work well together. So you might do like a series of microneedling and then put a little bit of filler in.
Moles.
In that you don't like them? You want them gone?
Yeah, just think cosmetic mole.
They can be removed. It sort of depends if they're flat or they're raised. A lot of times we may start out by just shaving them flush with the skin.
Redness. Rosacea.
Lasers tend to work well for that to reduce down the redness. Rosacea, if there's an acne component, there's a lot of good topicals and some oral medications that you can do for that. But if it's just the redness and the broken blood vessels, lasers, I think, work the best. There is a topical cream called Rofade that helps constrict the vessels. So if you put it on in the morning, you look less red through the day. Also interesting, green tint offsets the redness. So green tinted makeup helps. And there are some topicals for rosacea that bring down the redness a little bit. I don't think it's anything too dramatic.
Skin tags.
Skin tags. So you can snip them with like tiny little scissors. You can treat them with a little...
Really? Just
No, not you.
No. Really? You mean, okay.
No. That's not the way I typically do it. I typically do a little electricity or heat. You can do a little liquid nitrogen. Some people do them with a little teeny tip. But yeah, you can sort of just ablate them some way, whether you're doing it with something cold or heat or electricity. And if they're really large, then we, snip them off or shave them off.
And our last one is dry, tired vag.
So there's actually a few things on the market for that. There's something called FemTouch, which uses a very low dose of a CO2 laser. And again, it helps stimulate the collagen. There's another one that uses radio frequency. We're probably going to have more coming out because they're looking at some other interesting ways to do it in Europe. Even for like that urinary leakage, like when you cough or sneeze. So I think that's sort of a pretty evolving field. I think, hopefully we're on the market to get some stuff addressed for us.
We're on the upswing for advocacy of that.
Yeah,
absolutely.
But,
Feels like it.
So I started doing FemTouch. We actually bought a machine, and it actually happened to be part of the machine, so it wasn't even on our radar. And I had a background in gynecology, so they asked me if this is something I would consider doing, and do I think there's a market for it? So I actually asked a few of my patients who had breast cancer, who couldn't do anything like estrogen creams, because that's one of the common things that are prescribed.
Right.
Are estrogen creams as we get more dry down there. And so they couldn't do estrogen creams. So I'm like, hey, do you want to be my model? Let me know what you think. And the results were pretty dramatic for them,
Really?
Yeah.
What
they felt like they had more moisture. It was, I had women who said it was really painful to have sex. I had a couple of women who hadn't had sex in like 5 years.
Oh, yeah.
Because it was
I have a couple
painful.
of friends
I have
like
friends
that
like
right
that
now.
too.
Yeah. And they were actually able to have sex and enjoy it.
And this was with the FemTouch?
This is with the FemTouch. That's the one that I'm familiar with.
And
there's other ones out there that also have good studies behind it.
And what did you say is happening with that?
So it's a low dose of CO2. So that's a laser ablation. So you're doing a very low ablation to the tissue to stimulate collagen. And people have even said, I have some women in their 40s who are postpartum who have said it helped with, their runners, that they would leak when they ran. Yeah. And it would help with that. And then you have to typically do one treatment a year to maintain it.
That's interesting. I feel like I don't want to say it's a one-stop shop because it's doing the same thing, right? That FemTouch, it's the same procedure each time, but it's giving you more moisture and it's getting rid of pain when you're having sex.
Well,
how is that possible?
So pain that's a complicated.
Is that just because you're not moist?
Well, there's a lot of reasons why you can have pain with sex. From, we're anticipating it being painful. So there's an anxiety component to we're dry. This is really just addressing the pain is because you're dry.
Got it.
Not for, there's there's multiple reasons why women will have pain with intercourse.
I feel like that particularly could be a game changer for women in especially the demographic that we're talking to.
I feel like when it works
after menopause.
Yeah. And when women come in and they say the reason that they want to do it is for pain with intercourse, we do talk a lot about like where the pain may be coming from.
Right.
And setting up a realistic expectation. But I've definitely had patients come back say, oh my gosh, like I haven't had an orgasm in 10 years because I didn't want to have sex. It was uncomfortable. Like I actually can now have that type of intimacy with my husband again.
So let's ask you the one wrap-up question, which is what is the one product or service you can't live without?
I should say sunscreen because that would be really good.
Well,
for me
we'll
to say.
assume that everybody needs to use sunscreen. So we'll give you the out on that because I think at this point everybody in our demographic knows that.
I think that answer will be such an individual thing based on how your face is and how you age. I didn't lose a lot of fat in my face, so yes, I like fillers and I use them. But if I had to like start from the beginning, what was going to really keep my face looking not as aged was Botox. So that's the one thing I'm consistent with.
Visit the rawfemale.com website to shop our marketplace, check out our show notes, and learn more about Kris and Allie and the folks who put together Raw Female.
Like what you hear? Rate and review us.
This episode sponsored by Tom Baroni, because it's all about the numbers and the lube.